So atrial fibrillation is basically an abnormal heart rhythm. It's where the top part of the heart starts just beating a little chaotic. It beats out of turn and beats out of sync from the normal heart rhythm. Probably one of the most common causes is untreated hypertension or high blood pressure. There are multiple things that cause it: excessive alcohol use, tobacco use, stress, stimulants, over-the-counter medications for sinus, such as the Sudafed or the phenylephrine, smoking, drugs. There's just a number of things, underlying heart problems where the heart valves are not working like they should, or for some reason if the heart function becomes weak and the heart's not able to pump as it normally does. So the thing we probably worry about the most as far as complications would be a stroke. When the heart is in a normal rhythm, all four chambers just kind of squeeze and pump the blood out like it should. But when you're in this rhythm, the two top chambers of the heart, they quit squeezing and they just kind of quiver or fibrillate or flutter, and the blood can get stagnant and can form a little clot, and that clot can break off and go to anywhere in the body, but the place we worry about the most is the brain, which can cause a stroke. One of the most common things is people get short of breath, and it may not be just sitting around. It may just be where, say they're a very active person and they run 2 miles a day. Well, it gets where they get to the mile mark and they're, man, I'm just tired, I'm out of breath. Or it's just, I'm walking through the house and I'm giving out of breath, or I'm starting to clean the house and I can't go as long as I used to. So it's really a lot of times just a stamina decline, or decrease in their overall energy level. They're staying tired and fatigued, and it can be stuff like chest pain, or people can get real lightheaded or dizzy with it. And then there's the people that actually feel their heart beating out of rhythm. And for people that have a significant stroke risk and they have this rhythm problem, the number one goal is to prevent stroke. So we end up using either anticoagulation with stuff like Coumadin or Eliquis or Pradaxa, Xarelto, those things you see on the TV, or stuff like antiplatelets like aspirin, or things like that to help prevent stroke. That's our number one goal. And then probably a secondary goal is to help slow the heart rate down if it's going too fast. So there's medications we can use for that. We can actually use an electrical treatment for an electrical problem such as a cardioversion, where we actually can shock the heart back into rhythm. There are also medications called antiarrhythmics that are available, and ultimately, if we want to see about getting rid of the problem, there are procedures that we can do that are minimally invasive, called an ablation, which our colleagues that are electrophysiologists, or as I like to call them, electricians of the heart, they can go in and actually try to get rid of the source of this problem. When people notice changes in their stamina, or if their heart, they can actually feel their heart out of rhythm, or if they start developing chest pain, or some cases you can pass out, but that's not very common. But if you start noticing a big change in your overall health, then it's worth at least seeking going to your regular doctor or having a physical done. And some of this can be picked up on exam by your regular doctor. But if not, they can do it. If they suspect it, they can do an EKG or an electrical cardiogram, where it's just a group of wires that we attach to your chest and kind of measure the heart's electrical system, and we can tell by looking at that.